Welcome back, registered nurses to be. In this video, I'm going to take you through 5 winning tips for getting the nursing diagnosis right all the time. Stick around if you want to hear more. The second phase of the nursing process is diagnosing. In this phase, the nurse groups related patient data gathered in the assessment phase to describe their judgment about how individuals, families, groups, and communities responded to health problems and/or life processes. This is the distinction between the nursing diagnostic statement and the medical diagnosis, which represents a pathological state. Now that we know what the nursing diagnosis is, let's get into the tips. Tip number 1. Be able to differentiate between the different kinds of nursing diagnoses. The first type of nursing diagnosis you should be aware of is the actual nursing diagnosis. Nurses write this diagnosis to represent their judgment about an undesirable human response to a health condition or life process that actually exists. Actual nursing diagnoses can be written for an individual, family, group, or community. For example, the actual nursing diagnosis displayed here is written for a patient who is feeling pain in their left leg. The next type of diagnosis nurses write is the risk diagnosis. The risk diagnosis represents the nurse's clinical judgment about the susceptibility of an individual for developing an undesirable response to a health condition or life process. Think of a risk diagnosis as a problem waiting to happen if the nurse and healthcare team do not take preventative measures. For example, the risk diagnosis displayed here is written for a patient who does not have an infection, but because their skin is broken, if the nurse does not take preventative actions, the patient is likely to develop an infection. A health promotion or readiness diagnosis is another type of diagnosis that nurses write. The readiness diagnosis is the nurse's clinical judgment about a patient's motivation and desire to increase well-being and to actualize health potential. These diagnoses are written for patients who are ready to move from their current state to a higher level of health, well-being, or knowledge. In cases where individuals are unable to express their own readiness to enhance health behaviors, the nurse may determine that a condition for health promotion exists and then acts on the client's behalf. For example, the readiness diagnosis displayed here is written for a patient who was previously diagnosed with ineffective coping, which is another NANDA label, and now expresses a willingness to engage in behaviors that will enable them to cope more effectively. Last, although less frequently used, nurses also write syndrome diagnoses. A syndrome diagnosis is written based on the nurse's clinical judgment about a specific cluster of nursing diagnoses that occur together and are therefore best treated together and through similar interventions. In this example, the patient has several nursing diagnoses which cluster to form the syndrome diagnosis of neonatal abstinence syndrome. Tip number 2. Know what to include in each type of nursing diagnosis. When writing your nursing diagnostic statements, each will include a different combination of the NANDA diagnostic label, the related factors or etiology, and the defining characteristics or risk factors. Each type of nursing diagnosis will have a different mix of these components. Before we get into the specifics about how to combine these components to write the different types of nursing diagnoses, let's first look at what each component is. The diagnostic label is the name of the diagnosis, and they are provided by NANDA International. The risk factors are environmental, physiological, psychological, genetic, or chemical elements that make the patient vulnerable to developing an undesirable state. Only risk diagnoses have risk factors. Because the problem has not yet occurred, there are no manifestations or signs and symptoms. Defining characteristics are signs and symptoms which demonstrate the presence of the problem named by the diagnostic label. Think of them as proof of the presence of the problem. The related factors or etiology are those things that happen which cause the problem or syndrome named in the diagnostic label. Only actual diagnoses have related factors. Now that we know each component, let's look at the different types of nursing diagnoses and how these components are combined to formulate them. The actual nursing diagnosis has three components: the NANDA label, the etiology or related factors, and the defining characteristics. It takes the format of NANDA diagnostic label related to related factors as evidenced by the defining characteristics. For example, acute pain related to soft tissue trauma as evidenced by patient verbalization of pain to left leg rated 9 out of 10. In this example, acute pain is the NANDA label, soft tissue trauma is the related factor, and patient verbalization of pain is the defining characteristic or manifestation. The risk diagnosis has two components: the NANDA label and the risk factors. It takes the format NANDA diagnostic label as evidenced by risk factors. Because the problem has not yet occurred, this type of diagnosis has risk factors, not manifestation. An example of a risk diagnosis is risk for infection related to break in the continuity of the skin and immunosuppression. In this example, risk for infection is the NANDA label, and break in the continuity of the skin and immunosuppression are the risk factors which put the patient at risk for infection. The wellness diagnosis has two components: the NANDA label and the defining characteristics. They may have related factors if they help to clarify the diagnosis, but it is not mandatory. In the wellness diagnosis, the defining characteristics provide evidence of the patient's desire to improve their current health state. The defining characteristics can also represent the recognition by the RN that an opportunity exists for health promotion. It commonly takes the format NANDA diagnostic label as evidenced by defining characteristics. For example, readiness for enhanced coping as evidenced by expressed desire to enhance management of stressors. In this example, readiness for enhanced coping is the NANDA diagnostic label, and expressed desire to enhance management of stressors is the defining characteristic. Last is the syndrome diagnosis. It has two components: the NANDA syndrome label and two or more NANDA diagnostic labels which cluster to form the defining characteristics. For example, neonatal abstinence syndrome as evidenced by disorganized infant behavior, impaired comfort, ineffective infant feeding pattern. In this example, the NANDA syndrome label is neonatal abstinence syndrome, and the evidence of its presence are the cluster of related diagnostic labels which apply to the patient to form the syndrome. Tip number 3. There must be a match between the defining characteristics and the patient's assessment data before you can correctly use a NANDA diagnostic label. Each NANDA diagnostic label has the following which aids the nurse to use a diagnostic label correctly and to understand when another nurse is communicating their judgment about the patient's state. First is a definition. The definition of the diagnostic label is the meaning of each diagnostic label. The second is the diagnostic indicators. Diagnostic indicators include defining characteristics, which are observable cues, inferences that cluster as manifestations or signs and symptoms of a diagnosis. An assessment that identifies the presence of a number of defining characteristics lends support to the accuracy of the nursing diagnosis. Risk factors are another diagnostic indicator, and they increase the vulnerability of an individual, family, group, or community to an unhealthy event. A nursing diagnosis does not need to contain all types of diagnostic indicators. Actual diagnoses will have defining characteristics, and risk diagnoses will have risk factors. Students frequently ask how many defining characteristics or risk factors must a patient have for them to use a diagnostic label correctly. The truth is, it all depends on the diagnosis. For some, all you need is one, but for others, you will need more than one to accurately demonstrate that the problem exists. Before you get worried, hold on, let me explain. Take the NANDA label acute pain, for example. Because NANDA defines pain as a subjective experience which is present when the patient experiencing it says it is there, all you need is the patient's verbalization that they are experiencing pain for you to accurately use that label. The addition of other defining characteristics for this diagnostic label is not mandatory, but their addition can help to make the diagnosis more specific. NANDA describes what we call dehydration as deficient fluid volume. Although weakness is a defining characteristic for deficient fluid volume, on its own, weakness does not mean that the patient is dehydrated. To use this diagnostic label correctly, you would need to cluster other signs and symptoms to accurately diagnose the patient with deficient fluid volume. Tip number 4. Ensure that each component of the diagnostic statement relates accurately to the next. To ensure that each component of the actual diagnostic statement relates accurately to the next, ask yourself the following questions to arrive at each component of the actual diagnosis. Number 1. What is the patient's problem? After following tip number 2, you would have known this because it is the diagnostic label which you chose based on the patient's clustered assessment data. In this example, it's acute pain. Next, ask yourself, what is causing the problem? The answer to this question provides you with the etiology or related factors for the diagnosis. In this example, soft tissue trauma is the cause of the pain. We already know that the nursing diagnosis is formulated from the nurse's assessment of the patient. However, when writing the etiology in your diagnostic statement, knowledge of the pathophysiology of the patient's medical diagnosis can give you an insight into the cause of the problem you identified. To arrive at the defining characteristics, ask yourself, how do I know that the problem exists? Arriving at the answer to this question should be uncomplicated, as these are the signs and symptoms you clustered after your assessment which led you to choose the NANDA diagnostic label. In this example of acute pain, the patient's verbalization of pain lets us know that acute pain is manifesting. Let's look at an example using a risk diagnosis. Let's first ask ourselves, what is the problem? And the answer to that question is risk for infection. That is your NANDA diagnostic label. Next, ask yourself, what is placing the patient at risk? The break in the skin's continuity and the suppressed immune system. As long as your response to these questions provide a reasonable answer, it is extremely likely that you'll be able to form a nursing diagnosis in which all the parts relate correctly to each other. Amazingly simple, right? Comment down below if you use this tip and let us know how it worked out for you. If you made it this far, thanks for sticking around. For your commitment, I'm going to give you a bonus tip. Ready for the bonus tip? Come close and listen carefully. Your nursing interventions will target the related factors in the actual diagnosis or the risk factors in your risk diagnosis. Correctly identifying the precise cause or risk factors in this step is the first step in planning appropriate patient-centered nursing interventions, since two patients can have different related factors for the same NANDA label. Think about it. If a patient has a risk for infection because their skin is broken, performing actions to help to heal the wound, among other things, helps to reduce and ultimately eliminate the risk factor. When the risk factors or related factors are gone, the patient no longer has that problem. Tip number 5, practice, practice, practice. It might sound simple, but this is the biggest tip I have to share with you. NANDA is a language with rules just like any other spoken language like French or Arabic. In the same way you had to learn the rules of the English language and then learn the meaning of words and the appropriate context for those words, NANDA is no different. This means that you will have to have a reference text with you when you're practicing. If French is new to you, surely you would not attempt to construct a sentence in French without a dictionary. The NANDA diagnostic labels are new to you, so in the beginning, you will need to refer to a text. Last, in the same way you mastered the use of the English language and you now need a dictionary only once in a while, you can achieve that same level of mastery with NANDA, but it will only come with practice. We've come to the end of what I hope was another very informative video. If you like the content, don't be shy, subscribe to the channel, leave your comments and share the video with your batchmates and other nursing students. Thanks for watching and I'll see you in the next one. You can also follow us on Instagram at rn2b_876 for notifications on new and upcoming videos. The link is in the bio.